Quality and patient safety is the underpinning, the foundation of what we rebranded and built our system on since 2000. What we decided to do is become a national leader in the first healthcare system to be what is called a high reliability organization. If you go in the oil and energy industry, the nuclear industry, commercial aviation, there's just zero harm done to customers. And we have all these deaths that are caused in hospital-acquired conditions and infections. We wanted to eradicate those. The only acceptable answer is zero. We're well on that journey. Our hospitals go months and months now without a single event that can be tracked. We're not perfect year-round yet, but we're very optimistic that within the next few years, we'll be pretty close to our goal of, indeed, healthcare's first high reliable organization. Cultural change is the key aspect of making this happen. We learned early on, we were into the journey, we had successes, we thought, man, we're really good, we're on our way. And then we had a couple major incidents of both blood transfusions that caused death. They were within literally a week of each other, and it was a time to reevaluate. And so we relooked and said what we missed in this journey was the cultural change of our employees and our doctors. And so what we did is went to our board, this is back in 2006, and asked them for $18 million additional dollars to pull employees off the workplace, replace them with somebody else for a week of cultural training. We also trained over 3,000 of our doctors, and that began an immense return of improvements in our outcomes and our hospital-acquired conditions. Culturally, our employees get it. They're not afraid to challenge and ask questions, and they know that job one is to protect our patients. Yes, it's still a fee-for-service world and has not gone to fixed payment, but during this journey, a number of things have happened. The Affordable Care Act was passed. To fund that, they took reimbursement out of hospitals for Medicare, and we totaled all those reimbursement changes plus other things going on in the state and Medicaid, and those numbers, if you played it out and it won, our system would have been upside down $375 million per year by 2018. So in 2011, right after the bill was passed, we said, what can we do? First step is we took cost out, mostly overhead costs out of the corporation, about $160 million. The next big step we said is, let's take cost out to offset that revenue decrease through our safety programs. And in the first year, taking baseline where we were with infections and hospital-acquired conditions to where we ended the year, that was a $72 million cost savings. You cannot assume risk unless you got everything working in concert. You cannot, repeat tests. You cannot have hospital-acquired conditions. That's just devastating to the economic model. It's also not good for patient care, which should be front and center. So we believe very strongly we're prepared to go out and take risks today. Our clinically integrated doctors practice wonderful evidence-based care. Our systems processes are so hardwired that we're confident we can deliver care well below whatever premium dollar we're getting. With the burgeoning economics of our city, nobody's willing to change their healthcare plans. When we first entered into it, we were just in the midst of a recession, didn't hit Houston as hard as the rest of the country, but employers were looking at what options do we have to help better manage the health and get better value for healthcare. They were looking at narrow networks and fixed payments, and so we geared up to go down that track. And then as the economy has just boomed in Houston, the employers are having such a hard time attracting and retaining employees. They're not about to change their health benefits and ask them to go into a narrow network from a broad network. So we've seen a real slowdown of business moving from the traditional broad network fee-for-service to a value population health fixed payment. It's still there in small increments and we're able to capture it, but the bulk of the business is just staying over there, and the employers are telling us they're not about to make that change until the economics of Houston slow down. Last year, on a charge basis, we provided $1.1 billion of free care. And so we can't sustain that. It's growing over $100 million a year, free care and bad debt. And so that was for 3-4 straight years. So we had to try to do something to offset that. We decided to get into businesses that we all were losing. In the early mid-2000s, doctors were coming in, owning imaging centers, surgery centers, and we're niching all that profitable elective business away from us and leaving us with the indigent inpatient care. And so we decided to go grab that market share back and then grow it. And we had to do it in a retail manner. We call it our retail division. By that, we were trying to divorce it from the hospital side. We wanted patients to be able to drive right up to a storefront, separate scheduling system, separate billing system, separate everything, and run it more entrepreneurial and retail. And so early on, I made a decision in our system that no hospital administrative type could apply for the jobs. We wanted to bring outside entrepreneurs in. We did populate it with those types of individuals, and within 4 years, we rapidly grew. And today, we have over 200 ambulatory sites. We are a dominant player in all high-end imaging. We have 32 surgery centers, and we have more than 60 sports medicine rehab centers. And we also are into the diagnostic lab business. So it quickly, and it's all elective. That the only people that get in are people with insurance and are elective. So we take in our economics, where I was making 80% roughly of our profits from the hospitals back in the mid-2000s, to today I'm making 80+% off the retail ambulatory side. Longer term, my hunch is that they'll figure this out. People will come into exchanges. The penalties get steeper in the out years. And I think it will start to flatten out, and my hospital margin will pick up because I'm not writing off so much of the revenues to charity care and bad debt.